Carlson Building Maintenance presents Right to Know Hazcom Training, Hazards and Safety Measures in the Workplace. Globally Harmonized System, GHS. The Globally Harmonized System of Classification and Labeling of Chemicals, GHS, is a system for standardizing and harmonizing the classification and labeling of chemicals. It is a logical and comprehensive approach to defining health, physical, and environmental hazards of chemicals, creating classification processes that use available data on chemicals for comparison with the defined hazard criteria, and communicating hazard information as well as protective measures on labels and safety data sheets, SDS. The Hazard Communication Standard is now aligned with the globally harmonized system of classification and labeling of chemicals. This update to the Hazard Communication Standard will provide a common and coherent approach to classifying chemicals and communicating hazard information on labels and safety data sheets. Hazard Communication and Right to Know Program. Chemicals can enter our body through inhalation, skin absorption, and ingestion. Carlson Building Maintenance has developed a program to establish procedures for working with and handling hazardous substances. This program supports compliance with the Occupational Safety and Health Administration, also known as OSHA. This program applies to all company employees who are routinely exposed to hazardous substances. Routes of entry: inhalation, skin absorption, ingestion. Safety data sheets. Copies of SDS for hazardous substances to which employees may be exposed are kept at each location where employees are assigned to work in the safety box. Operations Management will be responsible for obtaining and maintaining the safety data sheet system for Carlson Building Maintenance. A list of all known hazardous substances will be kept in each of the SDS books. Operations Management will be responsible for maintaining the list and keeping it updated. In addition, the Human Resources Department has a digital and printed copy available. Please contact your supervisor or the Human Resources Department if you are not able to locate a copy of the safety data sheets inside the safety box located at your work site. This information should be immediately available upon request. Safety data sheets are formatted into 16 sections. 1. Identification. 2. Hazard identification. 3. Composition and information on ingredients. 4. First aid measures. 5. Firefighting measures. 6. Accidental release. 7. Handling and storage. 8. Exposure controls and personal protection. 9. Physical and chemical properties. 10. Stability and reactivity. 11. Toxicological information. 12. Ecological information. 13. Disposal considerations. 14. Transport information. 15. Regulatory information. 16. Other information including the date of preparation or last revision. Section 9 through 16 may include information that we won't use on a daily basis, but it is available in the event a product is transported or it is subject to special regulatory requirements. There is additional information on toxicological and ecological information. GHS labeling. GHS labeling will require the following information: product identifier, chemical identity, supplier identification, name, address, etc., precautionary statements, advice, hazard pictograms, visual warning, signal words, degree of hazard, hazard statements, nature of hazard, supplemental information, additional information about the substance. Container labeling. Any container with a label provided by the manufacturer will be considered acceptable for use and properly labeled when the label contains the following information: clearly labeled as to the contents. Appropriate hazard warnings are noted, for example, flammable, eye irritant, etc. The name and address or phone number of the manufacturer is listed. Damaged labels. Operations management will ensure that all containers are labeled with the original manufacturer's label or with a label that meets OSHA standards. If any container is found to have a missing or damaged label, please contact your supervisor immediately. Secondary containers. Sometimes we might need to transfer chemicals to a generic container. If this needs to be done, please make sure that the container is appropriately labeled. If you have any questions about appropriate labeling of secondary containers, please contact your supervisor. Do not transfer chemicals into unlabeled containers or other containers that had other chemicals in them. Health hazard terms. The GHS system has adopted the following health hazard terms: acute toxicity, any route of exposure, skin corrosion or irritation, serious eye damage or eye irritation, respiratory or skin sensitization, carcinogenicity, reproductive toxicity, aspiration hazards. Some of these hazards don't apply to the operations at Carlson Building Maintenance, but as you read through the safety data sheets or labels, please ask your supervisor if you have any questions. Pictograms. Pictograms are graphic symbols used to communicate specific information about the hazards of a chemical. The pictograms OSHA has adopted improve worker safety and health, conform with the GHS, and are used worldwide. The GHS system has adopted the following physical hazard terms that are described through the different pictograms. We will review all the pictograms, but not all of these hazards will be present in our regular operations. Flame over circle. This indicates oxidizers. Flammable. Flammables, self-reactive, pyrophoric, self-heating, emits flammable gas, or organic peroxides. Exploding bomb. This indicates explosives, self-reactive, organic peroxides. Skull and crossbones. This indicates acute toxicity, severe. This pictogram indicates corrosives. The gas cylinder pictogram indicates gases under pressure. This is a health hazard pictogram, and it indicates carcinogen, respiratory sensitizer, reproductive toxicity, target organ toxicity, mutagenicity, aspiration toxicity. This is the environmental pictogram, and it indicates environmental toxicity. A pictogram with an exclamation mark indicates that there may be irritant, dermal sensitizer, acute toxicity, meaning it's harmful, narcotic effects, respiratory tract irritation. General safety measures. All employees should exercise caution when handling chemicals in the workplace. Chemicals should only be used as instructed. Do not mix chemicals. Do not use a chemical if the bottle is not properly identified. Non-routine tasks. Periodically, employees may be required to perform non-routine tasks which require the use of hazardous substances, chemicals. Prior to starting work on such tasks, each affected employee will be given information by operations management about hazards to which they may be exposed during such an activity. This information will include specific hazards, protective and safety measures, and personal protective equipment that must be utilized. If you have any questions, please contact your supervisor. Noise. Carlson Building Maintenance is not aware of having exceeded OSHA's 85 dBA TWA action level, that means average daily dose allowed, on its regular operations. However, hearing protectors are available for your use during operations. Carbon monoxide. Carbon monoxide is a colorless, odorless, and tasteless gas that will cause headache, nausea, dizziness, if an exposure condition exists. This is produced whenever propane-operated buffers or equipment is operated. This type of equipment should only be used in well-ventilated areas. Compressed gas cylinders. Typical hazards which could result from abuse or mishandling of compressed gas cylinders include leaks and explosions. Safe handling practices. The following safe handling practices will assist in reducing or eliminating potential hazards. 1. The cage which stores propane cylinders at the client location must be clearly labeled with the contents and appropriate hazard warnings. 2. Container valves should be kept closed at all times, whether charged or empty, except when the container is in use. 3. Do not roll, drag, or slide containers. 4. When gas cylinders are not in use, they should be stored in the outside cages, standing upright. Remember to lock the cage. Please contact your supervisor if you need a key or new lock. Leak response information. Container leaks. Remove leaking container outdoors or to a well-ventilated area. Tag the leaking container with appropriate warning and notify Carlson Operations Management. For valve leaks, close container valve and tighten the valve gland or packing nut as appropriate. If the leak continues when the valve is open, reclose the valve and tag the container as unusable. General safety measures. Employees should contact their manager if they have any questions or concerns regarding the proper use and/or handling of any chemical used in the workplace. Strong acids and alkali. Acids are chemically active materials. They are not flammable, but they can react with other chemicals, as in the case of a leak or spill, and cause a fire, explosion, or the generation of a toxic gas. They may be found in both solid and liquid forms. Strong alkali are found in caustic cleaning agents. They also come in both liquid and solid forms. Physical hazards. Employees work mostly indoors in climate-controlled environments. Certain operations require employees to go outdoors for short periods of time. It is important to remember that there are physical hazards such as cold and heat that could affect the employees when working outdoors. Employees should dress appropriately when going outdoors. If there are special conditions, please contact your supervisor or the Human Resources Department. Infectious agents. There are 3 tasks that could involve exposure to infectious agents: surface cleaning at clinics, waste and trash handling, assisting others with first aid in the event of an injury. The best practice is the use of universal precautions, using gloves, hand washing, disinfecting surfaces. If exposed, please contact the Human Resources Department immediately. Safety box. Every job location has a safety box located in the housekeeping closet. The safety box contents include safety data sheets, personal protective equipment. Personal protective equipment, commonly referred to as PPE, is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. We encourage our employees to use the available PPE located inside the safety box. If you have any questions about the use of personal protective equipment or how it relates to the chemicals that you are working with, please talk to your supervisor. Personal protective equipment for Carlson Building's operations include gloves, dust masks, earplugs, and goggles. Here are some precautions or cautions you should consider. Wear chemical-resistant gloves, nitrile gloves, to prevent repeated or prolonged skin contact. In operations where the liquid could splash into the eyes, chemical goggles or a face shield should be worn. Earplugs can be worn when operating loud equipment. Disposable masks could be worn during cleaning operations to protect against dust. Now let's take a look at some first aid measures. For the eyes. If a chemical gets in the eyes, rinse cautiously with water for several minutes. Remove contact lenses if present, and easy to do so. Continue rinsing for at least 15 minutes, or seek medical attention. For the skin. In case of contact, immediately flush with plenty of water. If irritation occurs and persists, get medical attention. Inhalation. If chemicals are inhaled, the person should go outside for fresh air. If necessary, seek medical attention. Ingestion. If ingested, rinse mouth with water and drink plenty of water. Do not induce vomit. If necessary, seek medical attention. Accidents and injury in the workplace. Call 911 for any emergency or life-threatening situation. If you need immediate medical treatment, go to a medical provider. The Human Resources Department can help you find a medical provider that is close to you that speaks your language. Please call 651-481-9970 Monday through Friday, 8 a.m. to 4:30 p.m. for assistance. EMC On-Call Nurse offers 24-hour work injury nurse hotline services. With EMC On-Call Nurse, an injured employee and his or her supervisor can immediately contact a nurse anytime, day or night. The injured employee speaks directly to a specially trained nurse who immediately assesses the injury and recommends the best course of action for the injured worker, or directs them to a qualified provider if necessary. Reporting accidents and injury in the workplace. Call 651-481-9970 and select 0 for the operator between 8 a.m. and 4:30 p.m. on a weekday or any time on Saturday or Sunday. Call 651-481-9970 and select 3 for Human Resources if it is between 8 a.m. and 4:30 p.m. If no one is available to answer your call, leave a message with your name, employee number, and phone number, and a brief description of what happened. Call HR. Please contact the Human Resources Department if you have any safety concerns or questions by calling 1-866-481-9970 extension 205. Thank you for your attention, and please be safe.